Okay, good evening, everybody. I'd like to call the meeting, the Macon County Health Department Board, Tuesday, July 19th to order. Can we have a roll call, please?
Mark Scranton.
Here.
Jeff Entler.
Here.
Candy Clevenger.
Here.
Carolyn Wagner.
Here.
Jan Hack.
Here.
Debbie Hill.
Here.
Dr. Bridgeger.
Here.
Dr. Meningati. Cody Parks.
Here. Dr.
Schneider.
Here. Everyone rise and please join me in the pledge of allegiance. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Let's have a motion to approve the agenda topics. Any changes or additions? Anyone? Okay. We do have one change that Brandy's made me aware of. She was asked to move vision report presentation farther down your list, almost the end. She's asked to move that up to the section of that. If not, then we'll call roll call for approval.
Who was the first motion?
I was. Dr. Jerger. Dr. Jerger.
Thank you. And Jeff Entler, you were second, correct?
Yes.
Okay. Mark Scranton.
Yes.
Jeff Entler.
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner.
Yes.
Jan Hack.
Yes.
Debbie Hill. Dr. Jerger.
Yes.
Dr. Meningati. Oops. Dr. Parks. Excuse me.
Yes.
Cody Parks.
Hey, raise.
Dr. Schneider.
Yeah. Okay, do we have any public comment at this time?
Present, as we received no emails.
Okay, thank you. Okay, so do you want to do her division report, or do you want to get through a couple of these other items first?
Whichever way you'd like to do it is fine.
Let's go ahead and approve the previous meeting minutes. If you don't like to get a motion to approve the previous meeting.
There's one typo that, page 7, paragraph 1, actually starts facility determination of what it says litigation. What it should say, I believe, is mitigation. Talking about
Which paragraph is that, Carolyn?
first paragraph of page 7.
Eight counts from top there.
Oh, yeah.
I got
Should
it.
say
I see that.
mitigation.
That's no problem with that change. Okay, any other additions or corrections? Okay. Motion to approve the minutes.
First motion was Carolyn Wagner and then Cody Parks.
Yes.
Thank you.
Okay, roll call.
Mark Scranton.
Yes.
Jeff Entler.
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner.
Yes.
Jan Hack.
Yes.
Debbie Hill.
Yes.
Dr. Jerger.
Yes.
Cody Parks.
Yes.
Dr. Snyder.
Yes. Okay, so we'll ask Sheree to do her division presentation now.
All right.
Ready? Okay.
My name is Cherie Zelenka, and I'm the Chief Financial Officer here at the Health Department. I thought I would share a brief professional background on myself. I have a bachelor's in accounting from Milliken. After graduation, I began working at a local public accounting firm. While I was at this firm, I was able to be part of the team that conducted the audit of Macon County for the 3 years I was there. So while I was doing this, I became very familiar with the county right away and started building professional relationships with the staff at the auditor's office, a lot of the other departments, including the health department. So after working there for 3 years, I accepted the accounting position here and then later became the CFO. I have been at the health department for 12 years now and have continued to maintain a great working relationship with the auditor's office staff. I work with them at least on a weekly basis, if not daily basis. So at the health department, I supervise our accountant, 2 administrative assistants, and our 2 IT employees. I prepare, update, and monitor the health department's budget, as well as supervise the preparation of payroll, accounts payable, and accounts receivable. We are part of the same financial system used by the county. However, we prepare our own payroll and accounts payable here, but the auditor's office prints the checks. So we work along with them on those tasks. Then we pick up the checks and distribute them accordingly. I'm also very much involved in grants management from the start of the grant application and the budget submission, all the way through the monthly fiscal reports, closeout reports that are required. We typically have between 40 and 50 grants or projects every fiscal year. Employees in the administration division are also responsible for procurement, so all the ordering for the health department, onboarding and offboarding employees, as well as helping these board meetings run smoothly. Our IT staff keeps all of our equipment up and running on a daily basis, whether it be issuing new equipment or troubleshooting. We often joke that if it plugs in, IT can fix it. Although all things that plug in are technically not IT, so they really don't like that joke. They also evaluate and demo new software such as Digital Environmental and CureMD, which are in your packets tonight. They have also been integral in the recent upgraded phone system and our switch to fiber internet. Then I thought I would share a few challenges that I face. It's difficult to budget with the varying fiscal years that we have. Most of our grants run on the state fiscal year, which is July to June. However, we also have some on the federal year, which is October to September. And then our county fiscal year is December to November. So it's always kind of a challenge figuring out where things fit in. Working with the state on grants is often a challenge. It's not unusual for them to request a report turnaround in a day, or it's not unusual at all, actually. It happens way more than you would think. Also, everyone knows the financial stability of Illinois has not been the greatest. So there have been times in the last few years when we sit just wondering when we're going to receive payments. Staffing has also been a challenge in administration throughout the past year. But now we've been fully staffed for a few months. Training is time consuming and makes it difficult to get daily tasks completed, but the team's doing very well. And I think we're well on our way to being cross-trained throughout the division, and everyone is doing a great job. You're probably going to hear a lot from me tonight, so I tried to keep it brief. So if you have any questions for me right now, I'd be happy to answer them.
Out of all the grants that you do, how many are brand new and replicated every?
We probably, like, if you're not talking about COVID grants, there's probably only about 2 or 3 that are fairly new right now. Most of our grants are pretty recurring year to year. Our seniors division, they have a lot of little small grants, which we really consider more projects. Those kind of change up a little bit. But
I've always heard there's a whole different process to write a grant. Some are little, some are big, but
yeah,
there's a lot to them.
The division directors and Brandy and Bethany do a lot of the actual writing part too. Budget part.
Okay, is that it? Okay, thanks, Sharice. Okay, old business. I'm gonna go over where we're at on the appointment for the vacancy we have right now. Found out last week that this had been put on the agenda at the county board meeting. I didn't even know it was happening until somebody from the media contacted me to ask my thoughts on it. And well, it's news to me because I didn't know they'd made a decision or not. Brandy and I talked for that, and there wasn't a name presented on their agenda, if I remember correctly.
Correct, yes.
So went to the meeting and was told that they had decided to actually table the appointment. One of the persons that had put an application in for consideration, the county administrator had not been able to talk to that individual yet. So they asked me for my thoughts on that. And I agreed based on giving a real brief glimpse of the person's resume. It's one of the people we already had an application for, Ms. Butler. She's got a lot of very credible background and stuff, but I didn't get a chance to really read through it in very much detail because she'd been asked to provide more information than what was on her application, as well as I think a couple other people have been asked the same thing. So they decided to table it and then taking action on it. I called Brandy the next morning to let her know because we kind of went our own separate ways after the meeting. She had someplace to be and we didn't get a chance to connect after the meeting that night. But I like what I saw in this person's application. She's definitely got some good background concerning health and medical, but we have a couple other applicants that are probably just as strong candidates. But I told her that I was more than glad to have a conversation if that's what the administrator wanted to do. So she's kind of taking charge of trying to organize that stuff, which I think is good because they're going through the process to vet people out and make sure the recommendations are good recommendations. So I haven't heard anything since then, so I don't know what the status is, but I know the plan was to make arrangements to meet that individual either by phone or in person and have a little bit more conversation about their level of interest and background, that type of thing. So that's got postponed till at least probably next month's meeting. I'm assuming by then they will have made a decision on who they wanted to put in that spot, but that's where it stands as of right now. So we have Board of Health bylaws. I had another thing for old business. I know we talked about it last month. We would revisit again this month in regards to the current policy on masking. And I've been asked by a couple different people to bring that up again tonight and see if anybody's position has changed in regards to that one way or another. So I'm bringing that up for the good of the cause for conversation. If anybody wishes to discuss that again. Dr. Van Gotti's here. Thank you for being here. Would you like to maybe give us a little bit of update on where we're at with things right now?
I think Macon County is at the medium level now at this average, weekly moving averages have gone up. Then the predominant Omicron that you're seeing is the BA5, which is 65% of the, but not as severe, fortunately. So that pretty much drives the mask policy now. The highly contagiousness and moving average is going up already, and Macon County being at a medium level. That kind of drives the go by CDC. They still say at all levels, especially in indoor public spaces, as much as they can.
Appreciate that. I also had somebody send me some information that's fairly current. I tell you, I went and started doing my own research today, and they're not getting very good updates out there from CDC or IDPH, either one, on current status as far as guidelines and stuff. But this was sent to me, and it says, under OSHA's rule, does a healthcare setting include part of a healthcare facility or medical office or building operated by a healthcare provider or health system where there are no patients, no healthcare being delivered?
If a healthcare provider or health system has a standalone building where no healthcare is delivered, no patients are allowed to enter it, it would not be considered a healthcare setting. If there is a part of the facility, which this building would fall in that category, where no healthcare is delivered and no patients are allowed, and so it's physically separated from areas where patients are allowed or healthcare is delivered, with walls from floor to ceiling, door that remains closed when not being used, that space would not be considered a healthcare setting. If individuals are permitted to be in these non-healthcare setting areas without a mask, face covering, or face shield, they still must wear a mask, face cover, or face shield within any area that is a healthcare setting. So, in other words, the interpretation would be that if we enter the building, as we all did tonight, and you walk through the waiting room area, that would constitute a healthcare setting environment because you're passing through an area that's commonly shared by people with a variety of illnesses and things like that. However, this meeting space being contained in a non-healthcare room, that would constitute a non-healthcare setting. So that's just information I thought I would share. I was asked to share with somebody tonight. So I don't know if anybody has any more thoughts or considerations. If we want to stay on the path we're on still right now.
Where did this information come from that you?
This is under OSHA rule. This OSHA guidelines.
OSHA determination.
Yeah.
Okay.
Got too many government agencies
I know.
involved in this. That's part of the problem.
Well,
And none of them match. Their opinions
I know.
don't match. It's like calling the IRS and talking to 3 different people and you get 3 different.
that's the frustration.
Yeah.
Would we be at a point where we could make it optional in this room? Wear the mask through the building, location contact could be potentially encountered or have recently been, and make it optional for those who wish to continue wearing masks or do not continue to wear masks in a meeting space. What's your thoughts? What are people's thoughts on that?
Before we go too deep into that, I just do want to clarify to everyone, we do sometimes provide services in this room to patients, including but not limited to vaccinations. So I do think that it would probably still qualify, but I don't mean to stop the conversation. I just want to make sure everybody knew
that's
that.
good information. So this is a clinical space.
Sometimes, yes. When we're seeing more people, or if we would be having a larger clinic event, for example, when we're running vaccination clinics or back to school vaccinations, or if it's flu time, or with COVID, when maybe all of the exam rooms are not enough to serve everyone in as efficient manner, then yes, we would use this room.
Would that be on a weekly basis? Would that be on a
It just
monthly
depends
basis?
on the time of the month and what's going on. It varies.
Do you know, is it on the day that we meet?
Sometimes it has been, yes, but not every single time that we meet. And then my other thing I would say is, and I don't know if Mike can even speak to this without having a chance to research it, but there is an OSHA ETS that we have had to work with some of the rules that we've had to follow. So I would definitely, a lot of the decisions that we have made about masking and mitigations as a healthcare facility have been based on that. And so I do just want to make sure, again, that we're following that so we don't subject the organization to any kind of liability with that.
So basically, legally, OSHA is really who you would, as an organization, need to answer to. The rest are just simply guidelines, whereas OSHA has mandates.
Mike, is there any chance you would feel comfortable speaking to that tonight, or would you need more time to look at things? I don't.
Not super comfortable. I can give you generalistics. I mean, any employee or employer organization is going to be in some way, shape, or form subject to OSHA regulations. I can't speak at this point with what OSHA's regulations when it comes to masking, how mandatory versus directory they might be, what type of administrative or civil penalties may be attached, or what type of civil liability we might be exposed to if we do something that is in contravention of an established OSHA regulation. So generally, I will say that as a public building, as a workplace, and as a place of public accommodation where we welcome members of the public into the building, we certainly are regulated to some extent. Would be subject to the regulations, but I can't speak at this what those regulations actually require.
This guideline is referring to active activity going on in the building. So I mean, we come in, there's nobody in, but that area is used for that. I don't know, that's kind of a gray area, I suppose. What is the rest of the county doing currently? Courthouses and the county building, what are they doing?
I know in the courthouse, there is no mandate in terms of wearing a mask. Social distancing is encouraged. I think that if people are positive or, in a situation where they are supposed to be quarantining or isolating, that's a different situation. As to the stringency of the enforcement mechanism, I can't speak to that. And I think that the county building is generally on the same wavelength, but I couldn't, again, speak with authority as to exactly what their policies and procedures are, because that's something that's being implemented by the presiding judge's office and the sheriff.
Yeah, I know when voting was going on, nobody was enforcing that or had any kind of signage or.
I think with the
anything, and I know
absence.
county workings don't either.
Right, I think with the absence of an executive mandate from the governor's office that there be masks in public places, I don't know that there's any legal requirement for public buildings that are not healthcare in nature to have any type of, requirement that people mask or socially distance. Yeah, I think it's encouraged, but I don't know that there's any absolute mandate.
Also some CMS mandates, some CMS mandates on the people who go on Medicare, Medicaid.
Okay. So, I mean, and I think Sledger brings up a good point. It's not just OSHA. The CTS that you're referring to with OSHA, whether it's applicable here or not, OSHA is not the only entity that we would be subject to the regulatory authority of.
That's the problem, got too many people telling you different
And
things.
you have them in the federal government and the state government. So for me to be able to sit here and tell you what you can and can't do, there are simply too many permutations and a lot more research that would have to go into being able to answer that question.
For healthcare.
In terms of maybe saving you a little bit of time and energy tonight, I will point out that taking action on this subject tonight is not on your agenda, so it's not something you could actually take action on tonight. You can certainly discuss it as long as you want. But
Right, I was just bringing it up for discussion,
Right.
if I was asked, and it's under old business last month, so, okay. All right, well, we will keep moving along. Health board review of the bylaws. I don't know if we're in a position to make any changes, or if there's something that has jumped out, if anybody's taken the time to go through this. If anybody has any specific things, I know Mike brought up an issue last month in regards to voting, which is under Article 5, if you go to that, pages 4 and 6. That's one item that we need to see about changing.
there's also an issue in the bylaws with respect to the terms of office of your officers. Terms of office for Board of Health officers is actually set by statute. Now, this is something that I only came across, I think, either during the meeting last month or shortly thereafter. It's kind of hidden in one of the statutes in the county's code, but it is actually supposed to be concurrent with the county's fiscal year. So that's one change that I think needs to be addressed. And I will say that there are things that you may not want to necessarily keep in your bylaws. Things that are set out by statute shouldn't be covered again by the bylaws, because you you can introduce an opportunity for the General Assembly to make changes that are preemptive. And then you have bylaws that you think you're supposed to be abiding by, and you may not be aware of what the General Assembly has done, or that you're currently in violation of state law. So when you have a preemptive statute, I generally advise to leave, refer to the statute, operate according to the statute, but don't try to repeat what the General Assembly has said in your bylaws, because you're just asking for trouble when they have all the power and they don't necessarily keep you informed of what they're doing.
Not fine. Think about the voting,
Officers, Mark.
means of voting. Is it under officers, is that section under, okay? Okay, yeah, section B of Article 4, nominations for the floor may be made at the meeting. Or, it's on page 3. Section B, it says, if more than one candidate is nominated for a given office, a paper ballot will be used, which will be counter reported by the tellers committee appointed by the president. So that needs to be stricken.
Definitely, it's illegal.
Yeah.
This is something that I had mentioned at the last meeting in terms of doing a more thorough review of the bylaws and trying to catch some of these. I find the time in between last meeting and this meeting to prepare any type of presentation. I will try hard to get that before our next meeting, but it's something I'm working on. I haven't finished it yet.
Okay, so based on that and the fact that we've got a committee to look at this stuff too, let's table any changes bylaws right now, because my preference would be we do this collectively instead of piecemeal. That would be much better, more streamlined to do that. That way we can make the changes and recommendations that Mike may come up with or anybody else has that they want brought up, and we can put that stuff in more detail for next month's meeting and break it down by anything that you come up with, Mike. Let's make sure we do it by articles and subparagraphs if we can, to try to narrow it down as much as possible what currently says and then what preferences might be best for making the proper changes.
My tendency is to do a red line where I will either convert it into a Word document. Brandy may have it saved in an editable document. I tend to keep the PDFs on my own. So Brandy, if you could email me an editable document, but I redline it. That way you will see the strikeouts and the additions clearly in terms and any comments I might have.
Okay, great. I think that would be good. Anybody else? Comments? Okay.
Mark.
Yeah.
At last meeting, I know you did ask everyone if they had changes to send those to me, and I didn't receive any, just so you know.
Okay.
And then just so everyone knows, we do have a Board of Health calendar, and we do review these once a year. So, and I'm sure you read that in the bylaws, but we do always make sure we run those by legal. So just so you know that will be coming up again next year too. So that's all. Thank you.
The bylaws are in the packet. Please take time this next week, read through those. If you've got any comments or thoughts on any changes or corrections that need to be made, please send those to myself, Brandy. Mike gets those also, so that way he can look at anything we're seeing needs to be changed. Okay, update on that packet here. If you have anything, update on Popeyes.
There's not a document.
Okay, I know Brandy to check with staff to see what the status was since they were there last month and kind of get an idea what their intentions are going forward.
And Kathy is here.
Oh,
Mark
okay.
asked for that. She had just in the last few days before that already met with them and spoken with them. So Kathy will be able to give you the update on that meeting.
I don't need a microphone.
Yeah, I'm sure it'll be fine.
Y'all know me, I don't need a microphone. So yeah, I did go out to Popeyes, July 12th. I met them at 9 o'clock. There were a lot of different teams there, like a contractor team, an architecture team, a management team. I went into the lobby. That was as far as we got. They definitely have their work ahead of them. Pretty much all of the glass has been broken out. The building is just, looks like it's been ransacked through the whole building. I wasn't allowed in the back because there were some pictures that they didn't want a non-Popeye employee going to, so I didn't go back there. So we sat up front, we talked. I went over the plan review process of what's going to happen, along with not only would we do a plan review process, but we're also going to add some additional stipulations like what we did with WITS to them. They had no problems with that. I asked them, hey, what about the equipment? Are we getting brand new? And from what my understanding is from watching the meeting a couple times, they stated that they were getting new equipment. They are not getting new equipment. They are going to try and repurpose all of the equipment that's been in there this whole time. I told them that as long as it's working, it's maintaining temperature, it's going to manufacturer's recommendations. I can't force them to go new, but I would strongly suggest that we make sure that we go new, or at least make sure that this is all working. We talked about their making this a training hub for Macon County. I asked to see those policies and procedures to show me what their training is so I can make sure that our stipulations meet with them. I kind of don't want to reinvent the wheel if they're already going to be doing temperature calibrations and that kind of stuff. I don't want to reinvent the wheel. They said, somebody else will have to email me that they don't have that documentation, and haven't heard anything back from anybody at Popeye since then.
Did you read through the minutes from last month's meeting to see the conversation about what they said they were going to do?
Yes.
Okay, so they're already changing their mind that they're not going to buy new equipment then, because they made it sound like there was a lot of missing components that they had stolen and brought from Peter to pay Paul and had been moving stuff around. Obviously, the stuff's been sitting there for 3 years now?
Yeah.
Non-operational. So I would have concerns about them starting to change what they came in and sold us on. But I mean, we kind of gave them their blessing to move forward, for working with you guys based on what they presented to us. So I would like to make sure that if you see any other significant changes taking place that's not what they presented to this board, then I would appreciate it if you would keep us in the loop on that.
Definitely.
Don't need to know specific details, but they were talking about this was going to take a year probably to get back on track, and a big part of that timeline was them acquiring new equipment, because they were pretty adamant about that, I would think.
Yeah, and I know
Conversation they had with us, and I'm concerned that they're changing their mind, either because they're saying, hey, we got something here, we can get it fixed and we're good to go, or we gotta wait, a year to get this one piece of equipment that's gonna stop us from opening. And I mean, I can understand that to a certain extent, but I just don't want them to come in and say, we're buying all brand new stuff, and you go in there and they bought a refrigerator and that's it.
So I know that when we were there, they did still say that they were 9 to 12 months out, which is exactly what they said during the meeting. And that a lot of it was going to be based on how soon that they could get the things that they are ordering in. But again, it's hard for me, because I did specifically ask about the walk-in cooler, because we had issues with the walk-in cooler for the closure and prior to the closure on other inspections. And the gentleman that was on the contractors team, he's like, oh, no, it'll work just fine. It's fine. We're going to plug it in and it'll be fine. I'm like, oh, so we're not getting new equipment? No. Yes. Hi, I'm Kathy, by the way.
Kathy, not Carolyn. Were either of those two gentlemen who presented us there?
Nick was here.
Was with you at Popeyes?
Correct.
Is that the gentleman who is higher on up in terms of?
No.
Or Nick is the one that's more local?
Nick is the one that I believe he was from the
From
Bolingbrook area,
Arkansas.
maybe. I think the minute said he was from the Bolingbrook area. Is that
I
right?
think that was Merrily. I was
Okay.
from Arkansas, where Nick is from.
Okay, I
Yes,
apologize then.
Yes.
Okay, he's the more junior. of the two.
Yeah, he was the junior.
Yeah, he was there. The other gentleman was not, but the other gentleman was the one who invited me to be there, told me what time the contractors were gonna be there and what date.
How old is the walk-in cooler?
It's original to the building.
How long has that been there?
What the hell was that?
I never.
Gosh, I couldn't tell you without looking back
It's
at the
gotta be,
file.
what, 15 years old?
I don't know if Popeyes has been here 15.
12, 10?
I would say maybe 10-ish,
There's
around
10.
10.
Then what would be the problem of, if they have a new walk-in cooler? If they have problems every time.
Again, it's one of those things that, I have to get them to turn it on and we have to see if it's actually working.
Those are so.
They are. They are. We even talked about one of the prep coolers, because that was one of the issues for closing, that they had chicken in there and it wasn't holding temp, and we found out they had unplugged it, which is why it wasn't holding temp. And I said, we're going to talk about those, and they're like, but no, we think that once they get plugged in, it'll be fine.
No.
Okay.
So they believe the equipment's been sitting for 3 years, you're just gonna plug it back in and it's gonna be operational.
Yeah, I think they're going to clean it and they're going to plug it in and go from there.
So at what point will you go and do a site visit again? Will you wait until they call and say, hey, we're ready for a,
No, so they still have to
Inspection at
submit,
some
they
point.
still have to submit a set of plans. We did talk about, that just because they had one hand sink in this area right now, when they submit their plans, if we feel another hand sink is needed based on previous inspections in a different area, so that is something that we would require them to put in. We are not going to quote unquote grandfather the building in. I mean, that's not even an option, but I didn't want them to think that, because it's already been licensed once, they're going to approve the set of plans, and that's not the case. So until I get that set of plans in, until we go through the stipulations, and really up until they get all of that remodeling done, they don't have to plug any of that equipment in until they get it there. I'm pretty sure that when I was there was still no power in the building to begin with. So I think there's a lot of issues that they're going to have to deal with as the priority before we even get to seeing if the equipment's still going to be working.
so is it your understanding, because I kind of got mixed signals from them, because they talked about all these other franchises they own that are not like Popeyes, but non-Popeyes. Is this the same people that owned this the last time?
Yes.
And they said they brought management in and they dropped the ball on this thing and that's finally got closed?
Yes.
So, I mean, is this actually gonna constitute their third time trying to reopen then by the same owners then?
This would actually be their fourth.
Their fourth time?
Because there was a closure prior to us revoking that should have been a hearing with the board for revocation. And we could not get enough board members present in a quick enough time to keep having them be closed when it was our choice, or not our choice, but our fault that we couldn't get them together. So we actually reopened them when they should have had a revocation, and then they got closed again. So this will actually be their fourth time reopening with us. Lots of coolers, hot holding and cold holding
Once
temperatures.
they get it. Or
Yeah, and I think, one thing to remember too is that a lot of places like Popeyes, they do a lot of cooking and then they cool it down until they need it and then they start reheating it. So they're putting that hot chicken into a walk-in cooler to get it to cool down, which of course is automatically going to fluctuate that temperature in that walk-in cooler.
And especially if it's having problems, and they put that in there, that's not.
And especially if it's 100
Why
degrees
would they be
outside
cooking
too.
hot food and putting it in the cooler instead of putting it
Because
in
they
the whole
prep
cabinet?
it, they prep
They're
it,
prepping it for rush hours.
so they can get it back on the second thing higher and crisp.
So this 4 times over what time span has that been?
that all the main closures all happened probably within 18 to 24 months together. I mean, it was less than 2 years. I'm almost positive it was less than 2
So
years.
2
when we really
years
started.
prior to COVID, they were closed down 3 different times.
Mhm.
Especially with chicken, you've got to have that cooler. They said they were getting all new.
Yeah, but still, my problem with that whole situation is I don't want to keep Kathy and I don't want to get in a deep conversation about this tonight because they're obviously going to keep monitoring this. My problem is management, but at the end of the day, the buck stops at the door. You know, as a business owner, you know, as a business owner, you know, as a business owner, I know as a business owner. It doesn't matter what your employees do. If something doesn't get done right,
And chicken.
you're the one that signs the check. You're the one that pays the bills at the end of the day. You're the one that ends up answering for somebody else's mistakes. And I'll be real blunt with you right now. I really have a concern that you're telling me this based on past experience versus what they presented to us at the meeting last month, because I did not have any idea that it had been
Was
that
the
many
contractor
times,
saying they wouldn't buy the equipment?
or the same owners.
I'm sorry, Coach.
Was it the management saying they wouldn't go buy the equipment, or was it the contractor?
It was a gentleman within the contractor team.
Yeah, I'd say, I'd want to hear it from the main guy, not a contractor. Everybody knows how that
The
goes.
guy from Bolingbrook, yeah.
Yeah.
Maybe we should give him a call.
Yeah, because the contractor's there working on it, he could be saying, no, if it works, it works, if it doesn't, it doesn't. But when it comes to the end of the day, it's up to the management to say, this is what we expect.
But it's still the owner's responsibility to have good management in there. If they don't, then they should shut it down and go and clean it up. Like I tell you, there's another fast food restaurant in the area. It's probably got one of the most pristine records, to my knowledge, about how they keep up their stuff. And that's because their corporation really comes down on them, and they've got several places around to cater. So I think they really have to stay on top of their stuff, because if not, they got to answer for it. They get penalized.
Yeah.
There's a lot of repercussions for the owners of franchises and stuff like that if they don't toe the line. And I guess that's where I've got concerns. It's still going to be the same owners. There are different leadership within their structure, and I think that's one of the things they talked about when they were here. But I would just appreciate you keeping a close eye and stay in communication with them. I mean, if they don't do anything for a while, you don't hear from them, then we don't need to hear from you about it. But if some stuff comes up, whether it's concerns or just progress, I think we would like to know, especially if we're talking about this will be their 4th time making this run. I mean, most of us were sold on the idea of what they told us, but not only that, they said they're going to invest $500,000. I wouldn't go dump $500,000 into a business if I wasn't going to make it work, because that's a lot of money for anybody. So I got to believe that, if they're putting that kind of money on the table, that they're going to do the right things, getting the facility ready with training their people and everything else. But they're already backpedaling and telling you, hey, we may not replace this stuff. And that's okay. If they make a judgment call and they say it doesn't need to be replaced, we've had it checked out, you're okay with what you see when you go look at it, then that's fine. But I just don't want them to come back and say, well, we got by only spending $100,000 and we did just enough to get the door back open again. Because I'm gonna, how I am about food safety. I'm gonna have a problem with that. That's just my opinion. So, anybody else got anything, Kathy, on this?
I'm sitting here hearing everybody's comments and thoughts, and I would almost suggest that we hit this discussion with them head on in writing and say, based on the meeting that I had, you informed me that you would not buy new equipment, and based on the presentation by the vice president, he said he was going to do that. What's your plan? And then we've got a written trail of what they've
It's already in the minutes.
told us.
So they were gonna
Yeah,
do.
that piece is in the
That's what I'm saying,
minutes.
though. If
They were here for quite a while.
you may be listening to the guy that's here talking, but she may be listening to a contractor, which means nothing. You know what I'm saying? We're not gonna do that.
Yeah,
If
the other
big
guy
boss-
that was here for the meeting.
Yeah, the big boss might be saying, why'd you say that? That wasn't our plan. Our plan is to spend equipment, and you sat here and told the health department in a meeting that you're just the guy that's gonna paint the floors, fix the walls, that we went and buy new equipment. He may be totally off base, so we may be getting worked up over
Yeah.
nothing.
And I-
that's true.
That's true too.
I will agree with Cody, that happens more often
Yeah,
than
we see it
not,
every
that,
day.
Yeah.
that there's always a lack of communication between, you know, who's doing this
Right.
versus who's wanting it done certain ways. So I
And many
need to
times our
agree on
guys have
that.
said we're gonna do something and not knowing that we was gonna do something totally different, and we already talked about it, and we're the ones that get screamed at.
Yeah.
I would say unless you want to hear it directly from the horse's mouth.
But
Said it
but
here.
you need to make that judgment, Kathy, if you think that's the right thing to do, or suggestion helps.
I mean, if I put this set for 3 years and he said he was gonna replace it, I would go see the buyer and say, this is what you said, no exceptions, that's what we require. Now, the cooler might not need to be replaced, but the whole condenser unit and the whole cooling part would.
Oh, yeah, you know, I'm thinking like gaskets and all of
Yeah,
that stuff, and
that stuff
probably
sits on
after
the right
3
now.
years sitting in there with no power, they're probably nice and nasty.
Okay, I think we covered that.
Okay,
Are you here just for that?
nope, I'll stay for the next one.
Okay, that's why I wanted to ask. Because I've been waiting to hear about this for a while, so. Okay, next on the agenda is new business and
I'm
Yes.
sorry, I'm not sure where to interject this. I have a question, STD clinic, it just sprung out at me when I looked at a number today. And I don't know if this is where I discuss it or
let's go over that and get like the division reports.
division reports, okay.
And then we can place for that.
Thank you.
Okay. So new business, discussion and action for digital environmental contracts. So talk about, or Brandy wants to talk about, but this is the proposal for the new digital technology for the.
Well, I'm gonna refer back to Evan and Luke because they had a great analogy the other day. It's explaining why we have 2 separate contracts going instead of one. Look,
That's good
That was
because
not
I've
my
had people ask me that.
here.
Yeah,
That's all.
the analogy Luke used was like buying a car. And in this case, the Salesforce CarSoft contract, Salesforce is like the car that the manufacturer of the car. CarSoft is your dealer. The one selling it to you. The Summit Technologies, Umbrella, they're essentially the person you're taking it to make some modifications to your car. What we're buying here from Salesforce is a platform as a service that will belong to us. Licensed through Salesforce, we would hire Umbrella to come in and modify the base Salesforce software to meet our needs. And once that's done, Umbrella is gone, and we just maintain the relationship with Salesforce.
And one of the nice things that doing it this way that a lot of the other digitals that we looked at was that because it's with us, that we get to make changes. So let's say we wanted to add an additional line in an inspection form for something. We have the ability to do that ourselves in-house, whereas other digital companies, we would have to go to them and say, hey, we need you to redo this, and that would be at a cost to us. So we have the ability to do some minor changes ourselves at just Evan's time. I mean, that's great.
Salesforce
Is there limitations of what you can go in and change? Do they have a structure to where there's doors you can't open?
No, if you have a developer account with Salesforce, you can do just about anything within that software as long as you know what you're doing.
Okay.
And with it being with Salesforce as well, instead of some of the other companies, Salesforce is a well-known company. They're an industry leader in this type of software. They're not going anywhere. With every other one we looked at, it was built on some custom platform that the software manufacturer had designed. And if something were to happen to them, your stuff's gone.
Paid a lot of money for.
Yep.
Nothing.
Yep.
Total package price, because I'm assuming, looking at some of the documents, you got a bid last year. Is that correct? And now you've come back and the price has gone up?
No, they have been great with us, and they have held the price the same since last year. So what you're seeing has been the same price they quoted us since the beginning.
Okay, so what is the total package price? So
Sure, you
that
have
I
the total
understand
package price.
carefully, because I saw several batches of numbers.
So we would have to pay this year $60,875. Plus, we need about $6,000 worth of supplies and equipment.
Almost 70,000.
Then next year, the annual software license is $24,972. And in addition to that, for next year, we have budgeted $20,000 for consulting hours. So kind of went high with that number, thinking that they're probably going to need a little bit more support the first year. So that should go down in the future.
So every year you're looking at around $24,000.
Just under $25,000 a year at least. Yes.
And I will also say that this program, we can add, so right now we're just doing our food. That's our largest program that we have. But this company does have the ability to add every single one of our other programs. So whether it's septic, well, geothermal, tanning, back to body art, whatever, we can add it into this also.
So is that when you guys come in and inspect? It's digital and you won't have to do all that writing and
Correct.
45 minutes?
Correct.
Thank you.
Yeah, so it will have, it'll automatically have the canned comment. So, you know, your cooler's out would be in violation. The canned comment could be all cold holding must be 41 or below at all times. And then we could automatically add a comment, like we could say it's the front prep cooler or the back walk-in cooler, so we can get more specific. But a lot of those things will already be canned comments, so it's just checking which one it is, which saves us the time. And then Debbie, as you know, it saves you trying to read handwriting too, because we all have different
Because you
handwriting.
can't read that when it. And so you go over and say, well, and you can't read that.
How much will this, you know, obviously you haven't used it yet, but how much will this increase your overall efficiency?
I can't even imagine that number at this point.
Oh, my God.
You know, kind of like Debbie said, you know, we have been at facilities based on violations, just spending an hour writing 5, 6, 7 pages out, just because it's all by hand, and you try to be as concise and, you know, as specific as you can in case everything does get called into, you know, the court or whatnot. But my gosh, just the fact of being able to have so many of those canned comments and just, you know, click a button and, you know, automatically, hey, I'm at Popeyes, click Popeyes, and the whole top half is already filled out instead of us going Popeyes number 1, 2, 3, 4 located at da 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 da. I can't even imagine how much time it's going to save us. Now, I'm going to be honest, in the very beginning, it's not going to save us any time.
Yeah.
I mean, we're going to have a learning curve ourselves. But once we get used to it, I just can't imagine.
It's a learning
Yeah.
I mean, based on what your knowledge is about the process right now, is it going to cut your time by 30%? I mean, across the board, every inspection is different, I know.
Yeah. You know, I would say, I mean, that's kind of hard to say. I would say, you know, we've got somebody like Jerry, who's been doing this for 15 years. He knows all 700 pages of the FDA code book like the back of his hand. Some of our, you know, like John, my new inspector, sometimes he still has to look up, is this violation of priority or priority foundation based on what? So we're already at a different level of time spent in an inspection to begin with. So with this, I mean, again, with the learning curve, I'm going to say it's going to give us at least 15 to 20% once we really get into it and get comfortable with it. But again, you know, it's going to be a learning curve for all of us.
Yeah.
Let's not get carried away.
Well, and hopefully it does help, like you said, Debbie, for our food establishment partners too, to be able to take less time reviewing what we give them. And then also, you know, we do post all of that information online for our community. So then they will be able to review something a lot more easily and quickly without having to decipher.
Not so disruptive.
And, you know,
Sometimes it's disruptive.
oh, it is. And to add to that, that also saves some office time, and that once like right now, our process is once I get the paper inspections, I review them. I then give them to Susan, our environmental health clerk, who then takes them and scans them one by one to her email. She then has to open up her email and name each one by one. And then she goes onto our platform that we have and uploads them one by one. Whereas with the environment, the new digital software, the goal is to be able to, once I approve, boom, they go straight to our website. Yeah, we'll be able to do payment collections out in the field. Right now, we don't accept money out in the field. Our renewal process at the end of every year will just be so much smoother in the long run. We'll be saving money. I mean, I don't even remember what we're paying now for inspections. We hire out to Staples to get our inspection forms made. They're 2-part copies. So yeah, just so much. I mean, even down to the little things, like only one kind of ink pen works on the inspection form. So we have to keep ordering the same ink pen just to make sure it's, legible and can actually write on the paper.
I have, I've got a couple of questions. The way you're changing the software, does that mean that you'll be able to still easily accept the updates that they do on the base software every year?
Salesforce does updates constantly. It's a cloud platform, so they constantly update security updates, patches, fixes, all that stuff.
So you're not altering the base code. You're just altering via exits or.
Yeah, we'll alter the business processes that get layered on top of their platform.
And is this the same type of software that some of our sister counties use? Is it pretty prevalent in the marketplace?
So we will be the first one in Illinois to use this one. Some of the other counties around us have some other ones that I don't know if I contacted a county using another business that was happy with it. They had a lot of issues with them. So this will be the first one for Illinois, but this company normally works at the larger level. So they're normally working with like the federal agencies and the state agencies directly. They just recently, I believe last month or 2 months ago, I can't remember now, but just recently put a local health department in Ohio on it, and they were ready to go within 4 weeks from the time that all of the contracts were signed. Inspectors were out within 4 weeks with the new software. So I agree with Evan in that it's a very good company, but we will be one of the first locals in Illinois to use them.
Which, to put it in perspective, for a 4-week turnaround, that's incredibly fast. The last time we tried to go digital, the company that we worked with, we spent a year and a half on weekly or bi-weekly meetings trying to get all of our stuff situated in their cloud and ready to go, and eventually had to pull out the contract because.
Last question, is this software comparably priced to some of the other ones in the marketplace?
The Salesforce license is pretty much standardized as on how they charge their pricing. Yeah, the yearly license was pretty similar, I believe, for any of the different ones, whether it was their in-house platform they were building it on or whether it was something like Salesforce. Yeah. The upfront pricing is a different ballgame because we're having this company come in to build it, for us instead of almost as consultants coming in and getting the platform ready for us to use. Yearly was right at just under 25,000. 25,000, just under.
And was that for 10 licenses?
That's the last page of the contract. The 2-page or 3-page or whatever it was, right? Yep.
This is a number. So this is, can you pull the most recent one up, right?
Yeah.
Do you have that? This is the one.
Sorry. Hold on, that was the one we had to send back earlier.
Yeah, because the most recent one, it's showing, well, this one even is showing 8, but I think on the most recent one, it's giving us 10.
Are you paying per license?
Yeah, you pay various, there's a per user seat license. There are different types of, depending on what they do. There's one that's for the in-office, there's ones for the technicians, and then there's a service license that we're paying for. We would pay for Premier Success Plan, which gives you Salesforce direct technical support for any issues you might have. And
Okay, anybody else got any questions? Okay, we're gonna vote on these individually on these two contracts first, and then we'll move on to. So I'd like to have a motion for the contract with Summit Technologies. Discussion, roll call,
Mark Scranton,
yes.
Jeff Antler,
Yes.
Katie Clevenger, Carolyn Wagner,
Yes.
Jan Hack,
Yeah.
Debbie Hill,
Yes.
Dr. Jurger,
Yes.
Dr. Minigati.
Yes.
Cody Parks,
Yes.
Dr. Snyder.
Yes.
Okay, motion to accept the contract as submitted for Salesforce.com. Roll call,
Mark Scranton,
yes.
Jeff Antler,
Yes.
Candy Clevenger, Carolyn Wagner,
Yes.
Jan Hack.
Yeah.
Debbie Hill, Dr. Jurger,
Yes.
Dr. Minigati.
Yes.
Cody Parks,
Yes.
Dr. Snyder.
Yes.
Okay,
Thank
next
you.
item on the agenda is discussion and action for electronic medical records, the Cure NV contract.
Working earlier. Mark, do you want me to give a little background on this one?
What's that?
Do you want me to give a little background on this one since we haven't talked about it as much, or?
Yeah,
How
I
do you
think
wanna
for the
go about
benefit of
doing
everybody, that would
Okay.
probably be a good idea.
So this one is for electronic medical records in our clinical nursing division, and it would also be used by our WIC and family case management team. We have needed to get electronic medical records for several years, and this has been something that's been recommended in the countywide audit for several years. We did work a little bit on it when I first got started as administrator, and then of course COVID kind of slowed down some of that, and thankfully our clinical nursing and IT teams have done a lot of work to very thoroughly research the options that are available to us, what they can offer, and the pricing, of course. I will let them speak a little bit more to any questions that you have and some of the why, and certainly open to answer questions, but they really worked hard to find the right fit for a health department. A lot of electronic medical records are kind of too big for us. And so we'd be paying for a lot more than what we would really need based on the services that we provide and the number of providers that we have. And so I really feel comfortable that we found the best fit. They did a lot of comparisons. They did a lot of demos with these companies. Big thanks to Mike Baggett, sent everything over to him to look at. There has been a lot of back and forth with the company on some requested edits to the contract. So you probably saw that when you reviewed that there was some red lines that were suggested by Mike that we then sent back to the company. So there's been some conversation back and forth. Mike did send me an email this afternoon. You okay with sharing that, or do you want to?
Well, I'll just speak to
Okay.
it. One of the edits that I had requested, one of the concerns I had was that there was a provision in the, getting the acronym right, LSA?
Yes.
Okay, I'm gonna be able to remember that. Okay, the LSA is the master agreement. What they originally sent us was a quote that would sign and bind us. But it referenced the LSA and said by signing the quote, you're accepting the terms of the price quote in addition to all of the conditions in the LSA. So I wanted to see the LSA. I saw that. I made several requests for edits. They were very accommodating with respect to choice of forum in case there's any disputes. We will not go to, I believe it was the state of New York We're gonna instead sue them here. Hopefully we won't have to, but as a general rule,
Yeah, please.
I don't advise signing contracts that submit us to the jurisdiction before. Anyway, they were very accommodating there, but the one I had a big concern with was they had an early termination provision that said that in the event that we terminate for anything other than cause, that we would be liable for a $5,000 per provider fee in addition to a $100 per month per provider fee through the end of the contract term. I generally don't like liquidated damages clauses for elective terminations. So I asked for that to be modified or at least capped. I think they've attempted to accommodate us, but we ran into a little problem where their legal team can make changes to the master LSA agreement, and they did. When I made my last request to cap or eliminate the elective termination liquidated damages provision, the salesperson responded back with a change that I think the salesperson is authorized to make, but they're only authorized to change the quote. I don't like the idea of signing a quote that binds us to an LSA that hasn't been modified by their legal. So my suggestion, I think we have an agreement, but we need to combine the language that's been proposed by their salesperson and by their general legal counsel. So what you're looking at tonight is a fully formed understanding of what we would be contracting for. But before we sign anything, I'm going to make some inline edits to the LSA to clarify and add in what the salesperson has added. And if they sign off on that, which they seem to have agreed to, then I think we're all home. But that will be one final edit that will be submitted prior to the contract being effective. That was a lot. If anyone has any questions, I'd be happy to answer.
Then, based on that, because we sign off this, it's still got to go to the county board.
Correct. So
I would make a motion, we table this till next month, then.
you
If
can
that's the
certainly do
case.
that. I mean, the fact of the matter is, we can make the changes and have them approved. But I mean, the contract won't become effective until the county board signs off on it anyway. But we have an agreement at this point. It's just a matter of putting it in final form prior to signing the contract and paying over the money.
We're gonna make a decision to vote on this as it's presented tonight. If it gets changed, the county board's gonna be looking at a different document with changes that have been made.
Yes.
Does got a problem with that?
I don't think so. I mean, I think from what Mike's saying, we're language. So if we voted on it contingent on Baggett's acceptance of the wording, it sounds like that's kind of the path we need to take.
I mean, the way I see it right now is we have an agreement. It's a matter of reducing it to a final form. So no changes that I would make would change what, if the board were to approve it, to send it on to the county board tonight, no changes that I make would change what you approved.
Okay.
If that helps, I think
Yeah,
your
that
concern.
is.
I understand your concern. I
It's
just,
kind of the way I am.
I don't know what kind of timing, urgency the department has there, but I don't know if they want to postpone it another month.
I would prefer not to, but of course I respect the wishes of the board, but Mike and I have been working through this. We just got the final information from the company in advance of the last board meeting. I got it to Mike and we very quickly have worked through all of this just in last week. And the company's been very responsive. So, I definitely trust Mike and hopefully you all, and he, trust me that we will only make changes recommended by him. And we have done the contingency that Jeff mentioned before taking it to the county board. So we will do whatever you all wish, but we would really like to get it moving and, not delay it any longer. We're really excited to get moving
So
on it.
Mr. Dawson, not gonna change nothing.
No, I mean, the edits I want to make, I just want to basically incorporate what we have already agreed to into the one master document, because right now they appear to be in conflict, and the master agreement will preempt the sales quote. So I just want to take the language that has been given to us in the sales quote and put it in the LSA and say that this is the contract. If everybody's agreeable, this is what we'll go forward with. And if they're not agreeable, then we don't go forward. And Randy can bring it back to you next month with either an indication that they want a different change, or we're going in a different direction with a different company. I don't know.
So Mike, do we need to make a motion then to approve this based on?
I think as presented, because you have all the documentation and all the language, it's just a matter of consolidating it all into final form.
I have a question. Says first provider, are they speaking of the health department as the provider?
It's our medical director. Everything we do works under standing orders.
Okay.
So we will only have one licensed provider, and that will be our medical director.
And all of you may use it, you may utilize it.
Correct. As RNs, we can utilize it, correct, because we
No
all work
additional
under that
cost.
standing order
No
set from
additional
him.
cost.
Mhm,
Okay.
correct.
And what is your contract length?
12 months.
Okay, and then after that, it just becomes,
There is
Any
a
month to
90-day notice for an auto renewal if we choose to do that. That is built into that
Annually.
language.
It's like, it's not month to month, it's a year to year.
Do we know up
Renews
already
autumn.
what the price change may be a year from now? Have they shared that?
There's no estimated price
Okay.
change.
So this could double 12 months from now.
But we would get notice of that, and then again, an election not to renew.
Right, and I do just want to mention that obviously I don't want anything to double, but even if it did, it was still substantially more cost effective than the other systems that we looked into.
okay,
I mean, like by a lot, you know, this system is costing us $548 a month. And some of the other ones that we looked into, and there's the the implementation cost was right around 3,000. Some others were 21,000, 56,000, and 599 monthly for the other three kind of cost comparison. So even with any increase, it is still substantially cheaper. This is also the system that they use at Champaign County Health Department. So I went there and was able to view it as an end user perspective and with their super users that kind of built the behind the scenes. It is very user friendly. It has built-in billing. It also has built-in connection to iCare that will help us with our inventory. So it does a lot of eliminating the potential for human errors that I think is incredibly important. And it will also make us compliant with our Medicare and Medicaid standards and not receive any penalties for not having an electronic health record system as well.
The health board that you have been to, did you say it was in Champaign?
Yes.
How long have they had this on?
They've had it for, I think, just a couple of years. It's still fairly new to them. But I was, like I said, I was able to talk to the billing person, the person that helped build the behind the scenes. It's very easy to cater it to what you need. Because like Brandy said, some of these other systems were just monster systems. We're not doing surgeries. We're not doing post, we don't need all of that. So we're able to cater it down to just what we need it for. And the immunizations is obviously, the heavy for us. And their immunization flow was, like I said, it was very end user friendly. It did a really great job with getting into our inventory to make sure it automatically puts those records into iCare for us, that transfer that right now we all have to do manual. So it's going to save a lot of time, I think, in the end.
Yes, you may or may not know this, but did they see an increase in the payments?
That the what?
Did they see an increase in the payments? Then
We will probably see an increase in our reimbursement.
recovery payments from like
Any money
Medicare,
center.
public aid and.
Yeah, it has,
No.
it
My
has a
question is,
rejection built in,
did
so
the
that.
cost of the software go up every year for the Champaign County?
Oh, yeah.
Right now, no, it's a cloud-based program, so there's no like hardware we have to get, so it's just kind of like an application. I'm sure Evan can probably explain that better than me, but there won't be like a continued update that we will have to get. Obviously, applications get updated, but there's nothing to my knowledge that would indicate a cost increase due to any kind of a typical upgrade.
But what Dr. Manigotti's asking, if Champagne's had this system for 2 years.
They have an increase.
They have
I've
not,
seen an increase.
no,
Okay,
So the price stayed the same from the first year to the second year?
yes.
that's good.
Yeah.
Okay, any other discussion or questions?
Nope.
Okay, make a motion that we approve the contract with your MD as presented.
I'll second it.
First, Mark. Cody seconds. Mark Stratton,
Yes.
Jeff Etler,
Yes.
Candy Clevenger, Carolyn Wagner,
Yes.
Jan Hack. Here. Debbie Hill. Yes. Dr. Jerger,
Yes.
Dr. Benigati,
Yes.
Cody Parks,
Yes.
Dr. Snyder.
Yes.
Thank you.
Thank you.
Thanks, Rachel. Discussion action for resolution approving lease agreement for postage machine and meter for the health department. Document here. Like, we're gonna do a monthly plan or
I can
quarterly
take this
plan.
on, I'll take this on real quick.
Okay,
Our current postage meter lease expires at the end of September, so, we did get bids from 3 companies. We currently have a 5-pound scale and we would like to increase to a 10-pound scale. We are currently with Pitney Bowes and they have the best quote for a 10-pound scale, also. So we would pay quarterly, it's $227 each quarter. So the annual cost is $908. And it actually is going to be a savings of $122 a year compared to our current agreement. So we're getting a bigger scale at a cheaper price. And Mike has reviewed all of this also.
okay, any questions or discussion?
We have been, they do a good job.
Okay,
We haven't had any issues, and service is included also. One of the other companies wanted to charge $250 a year for service, whether you needed it or not, so.
okay, have a motion to approve this agreement for postage machine and meter as presented.
Is this agreement for 16 months?
Yes.
Second it.
Who was first on that one? Carolyn? Carolyn, Victor. Thank you.
Roll call,
Mark Stratton,
yes.
Jeff Etler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Jan Hack,
Yes.
Debbie Hill, Dr. Jerger,
Yes.
Dr. Benigati, Cody Parks,
Yes.
Dr. Snyder.
Yes.
Okay, I know we're gonna have to devote some time to the budget and pay grade scale, discussion. So I'd like to get through the items on the last, so we don't have to push some of these other things off. Board education, code update.
I just have a brief update. As Dr. Miniganti said, our community level is medium. Most of the states in medium or high. Our community transmission level, we are in high, and that's the one that is to be used by healthcare facilities for the mitigations to be implemented. Data through July 14th, the case rate per 100,000 is 468.23. That is a 38.75% increase in the last 7 days. Percent positivity is down 2.71%. Tests performed increased in 7.19%. Hospitalizations were down 37.5%. And percent staffed inpatient beds by patients with COVID-19 is at 3.2%. So still not, in a great place, but things as far as our function are continuing on, and we're still able to support the community in every way possible. If there are people that have health, the state does expect, as we go into the fall, to expect a surge and probably increases in numbers once school goes back in session. So hopefully that does not happen, but of course we'll keep you updated and keep the community updated if that does occur, and just kind of what's going on. And that's all I have for that. There was nothing else on board calendar for this month.
Okay, presentation and acceptance of financial report.
Okay, the report is through the end of June, which is 58% into the fiscal year. The fund balance is at 6.9 million. Total revenue at 4.5 million, which is 65.5% of budgeted revenue. Total expenditures at 3.7 million, which is 54% of budget.
Okay, have a motion to accept the financial report as presented. Second.
Who was first?
Cody.
Thank you, Cody.
Okay, roll call.
Mark Scranton,
Yes.
Jeff Entler,
Yes.
Candy Clevenger, Carolyn Wagner,
Yes.
Jan Hack.
Yes.
Debbie Hill.
Yes.
Dr. Jurger,
Yes.
Dr. Minigati.
Yeah.
Cody Parks,
Yes.
Dr. Schneider.
Yes.
Okay, review and approval of department expenditures. Packets and any questions on those all? No, entertain a motion approved. So moved.
Jeff Entler, Cody Parks,
Yes.
Mark Scranton,
Yes.
Jeff Entler,
Yes.
Candy Clevenger, Carolyn Wagner,
Yes.
Jan Hack.
Yes.
Debbie Hill,
Yes.
Dr. Jurger,
Yes.
Dr. Minigati.
Yeah.
Cody Parks,
Yes.
Dr. Snyder.
Okay, grant applications for review.
We do not have any this month.
Okay, right. Department division reports. I know Carolyn had a question on the STI fund.
I'm back.
I was just looking at, and I'm kind of thinking this may be a typo.
I think I know which one it is. Show me. It is a typo.
I was
I
like,
didn't look and was like,
oh my gosh.
Are you looking at this one? Yes. See
Okay.
how I fat fingered it on the way down?
So
That's
what should this
incorrect.
be?
It should be
Zero?
this was our first one.
Okay.
And this was kind of some backlog as we were getting caught up. So that is an error and I apologize about that.
Okay.
Was that the only question?
Yeah, so it is in May, under HIV, we show how many people presented to the clinic, the number of people that were counseled, and actually tested specifically for HIV were 21, okay? And then it showed up that there were 21 positive cases that same month. And
That
I
would be quite
assumed-
alarming.
Yes, it was alarming to me, and I assumed it was a typo, so
Yes.
it should say 0.
Thank you for catching that.
Okay, any other questions or discussion on any of these reports? Entertain a motion to approve this. Second.
Mark Scranton,
Yes.
Jeff Entler,
Yes.
Candy Clevenger, Carolyn Wagner, Jan Hack,
Yes.
Debbie Hill,
Yes.
Dr. Jurger,
Yes.
Dr. Minigati,
Yes.
Cody Parks,
Yes.
Dr. Snyder.
Yes.
Okay, employee recognition. Last page. We're out of order then. Okay, July anniversary. Evan Trimby, 17 years, Al, 16 years. Kurt, 5 years. Miller, 3 years. Thanks, everybody.
Congratulations.
Okay, do we have any closed session items?
We do.
No,
We
okay,
have some more. Minutes to
go ahead and jumping back into the other stuff first, do the closed session for last, or you want to go ahead and just get it out of the way?
Oh,
I'd rather not stop the meeting than,
I will say though that you're gonna want any from me. I'm sure I'm gonna be able to stay all the way through the budget presentation.
I appreciate that because, you told me that earlier. So I would make a motion that we go into closed session for the purpose of reviewing closed meeting minutes. Second.
All right, let me see here. First,
Cody's.
Mark Scranton,
Yes.
Jeff Entler,
Yes.
Andy Clevenger.
Yes.
Carolyn Wagner,
Yes.
Jan Hack,
Yes.
Debbie Hill, Dr. Jerger,
Yes.
Okay, roll call
Mark Scranton,
here.
Jeff Entler, Candy Clevenger, Carolyn Wagner,
Yes.
Jan Hack, Debbie Hill,
Here.
Dr. Brett Jerger,
Here.
Dr. Menegatti, Cody Parks,
Yes.
Dr. Snyder.
Here. Okay, have a recommendation per Mr. Baggett, State's Attorney, that we accept the closed meeting minutes as outlined as to which ones would be open and which ones would remain closed.
Dr. Menegatti and Dr. Jerger.
Mark Scranton,
Yes.
Jeff Entler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Jan Hack,
Yes.
Debbie Hill, Dr. Jerger,
Yes.
Dr. Menegatti,
Yeah.
Cody Parks,
Yes.
Dr. Snyder.
Yes.
Okay, so we're gonna backtrack now.
Mr. President,
You have to do, yeah.
so you would need a motion to add closed session minutes as.
Oh, I thought we heard both of those, okay. Okay, motion to approve closed session minutes.
Seconded.
Just for clarification of the record, that's as to.
Oh, okay,
Yeah,
gotcha,
you did the first batch
right.
for the historical records, but now you're doing last month's.
Mark Scranton,
Yes.
Jeff Entler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Jan Hack,
Yes.
Debbie Hill, Dr. Jerger,
Yes.
Dr. Menegatti,
Yeah.
Cody Parks,
Yes.
Dr. Snyder.
Yeah.
Okay, last two items on the agenda is discussion of the 2023 proposed budget and discussion of the Finance Committee met this last week. Myself and Jeff Upper were here for that meeting. It was our conversation. I know there was some discussion about where we thought we needed to be headed. A-grade scale, and the Brandy's included some of that information again tonight, along with some other documentations for review. One of the things that came up, somebody asked about, and we didn't get time to really get into that the other day, was like a request from staff to give a current printout of where everybody's at, individual employees, their job responsibilities, and current pay. I think that's going to be very helpful in the conversations that we've had about where to land on these adjustments for pay increases going into next year. So that being said, I don't know how much time we can spend on discussion of pay grade scales right now. I'll just share with the rest of the board what we discussed the other day. We looked at some different options, concerns about where we're at right now with some staffing. And I'll go to the highlights copy I got. You guys have got the same copy here. It's got the list by department breakdowns. Packet. Brandy had provided the one the other day that was highlighted. Obviously some concerns about some of the various departments with the vacancies, and part of the struggles they've had with that is just availability of people, compensation, and a variety of different things. The WIC program, family case management, was the one that I looked at specifically that caused me a lot of concern because there's 25 people in that department right now. You've got a pretty extensive amount of vacancies, there to fill. And that's a good majority of the vacancies the department has right now. We talked back and forth about how to look at what we would be comfortable with as a board for approving increases in pay. One of the ideas that I floated around for consideration, and we just basically had a conversation at our finance meeting the other day. We didn't bring anything to the board tonight for an exact recommendation, but when you look at this pay grade scale, starting salaries, you can see the wide range of dollar amounts that people are being paid for their various positions. And I don't know what the quantity of people is falling in different categories. So that's one reason I wanted to get some updated information on how many people fall in these different categories. But in your non-exempt categories, administration has asked for consideration of 4% cap for this year, give them the ability to do a raise up to 4%. I sat and did some math, and just for the sake of time, just kind of give you guys an idea what I came up with. So it gave levels that was down a 5% bump in pay. That's only about for the highest, and this would be, I based it on information on the highest paid person, which is the level 7. That's only like $1,400 a year. It's like $32 a week. So I don't think that's going to light a fire underneath anybody to feel like they've got, a really big pay increase. And then I was looking at 2.5% for levels 8 through 10, which is your supervisory levels. And I know there's some discussion about that being half of what the lower levels are getting, but if you look at the dollar amount and not the percentage amounts, that actually comes out to about $1,700 a year. So they're actually getting more than what the lower levels are getting. And then we looked at, a percentage of what we might look at for the administration levels, which is 11 through 13. And the reason I was looking at it is, you got to look at this. We have a responsibility to taxpayers and community about how we manage the money for the department, but also we need to make sure we compensate people appropriately for the job that they're doing. And the reality of it is we can't always be competitive with what's out there in the corporate world, but there are a lot of benefits that employees get here with 35-hour work week and the holidays and the flex time. So there are some other things that people are acquiring. One of the things I asked Brandy about looking into to talk to staff and see if there's a preference where they feel stronger about, I'd like to have more money, or I like the flex time, because some people value time with family and things are actually more important than monetary compensation. So I don't know if you had a chance to talk to anybody about that this week, because I know it's just been a few days since we had this conversation, but that's one of the things that we looked at, because I'm a big believer in lifting people up. I think if you set the tone to lift people from the bottom up, so to speak, that motivates them to aspire to do a better job. And I'm of the mind that I think people are appreciative if you give them something that it may sound like a lot from a percentage standpoint, but the reality of it is really not. And I don't think anybody here is going to entertain a percentage higher than that to give individuals, as much as we'd like to. But the reality of it is we're all facing the same situation now with increased cost, inflation, gas, everything's going up. And I'd love to be able to do more than what we are looking at right now, but fortunately, we don't really have that ability to do that. So that's kind of where I ended up with in the conversation for our committee meeting the other day. We didn't really settle on anything, but I think we have to give the administrator the flexibility to provide increases where appropriate, but I'm not in favor of a 4% provision across the board. Covers everybody, because I just don't think that's appropriate.
Real quick, I think you might have flip-flopped your numbers you just gave. If you give a level 7 a 5% raise, it is $1,700. And if you give a level 8 a 2.5% raise, it is $1,370.
Okay, you're correct. I just did the numbers real quick today that I didn't write them down. But the difference is pretty close there. And that was just if we did 5%, and 5% wasn't on the table. I just ran the numbers, and that's the dollar amount that I came up with for that. So I don't know what everybody else's thoughts are on creating some kind of environment to have this at different levels. Brandy did share with us in the finance committee meeting that they do evaluations that are performance-based along with some other factors. My problem I had with that for go to the room is the valuations are being done after we've already sat here and made decisions on approving the budget along with the pay scale. And to me, I think that's kind of getting ahead of ourselves. I want to make sure we have the money to give them the tools, give people what they need. And if we do the valuations after we've already locked ourselves into some prices, I think that's kind of the wrong approach to take. But that's just what I do.
Mark, on that scenario, isn't it a range? Isn't it a range that you could get up to? Let's just say for the sake of argument, that we were to say 3% across the board. On your type of evaluation, this is merit-based, this is not a cost of living raise, it's merit-based. It would go on the person's evaluation. So the highest that they could potentially get with a, whatever tool you're using, an outstanding 5 evaluation would be 3%.
Yes.
Am I correct?
Yes.
It could be from 0 to 3%.
Yes.
Is that right?
Yeah, the evaluation does have a scoring system, and then those scores, we have a score sheet basically that then would quantify what percentage of raise they would fall into. So when the budget is done, because we do have to do it so far in advance of the county fiscal year just to get everything approved, we do put in there, let's say, if the 4 was approved across the board, it would be, like you said, kind of a cap. And then if someone didn't earn the full 4%, that they would get what their percentage was. So it has not, messed up, for lack of a better way to put it, the budget, but then we do have the max amount budgeted in there. I will say we do not have a lot of staff that don't earn the full percentage. Obviously, in times like we're in right now, with the cost of everything going up so much and some of our pay levels being relatively low anyways, I do think it's really important to give as much as we can this year. And I mean, I say that every year, but I definitely, I want our staff to feel not only valued, but be able to pay their bills at the end of the day. And we do lose a lot of staff. And Mark, I was able to already survey our leadership team since last week to get some input. But, we've lost a lot of good people, unfortunately, because of not having the most competitive pay, or things we talked about last week and that were in our accomplishments and challenges document, where that, because we can't be as remote, be as flexible with hybrid hybrid options. People are leaving because of that now, because they can find, whether it's better pay, better benefits package, or the, remote or hybrid option that some staff are looking for. We've lost people, and I do fear that we'll lose more. So what I talked to the finance committee was about was, it's not only about the pay grade scale, that's literally just for incoming staff, for recruitment purposes, which is really important. But this is really about, we need to find ways to be more creative as an employer to not only pay, but also provide whatever kinds of benefits or flexible work environments for the staff that can do it, so that we can recruit people and retain people that are here. We, as Mark alluded to, and as you all could see on that form with the vacancies, we have 89 total positions. There are currently 14 vacancies. I now have another retirement that's coming up, so we will have 15 vacancies. Most of these positions are level 8 positions, which is our professional level and higher. All of our staff are professionals, of course, but that is more so like there's some kind of professional degree or certification or certain type of education that they are required by the grant or by statute to have in order to be in that position. And so I think it's not only about the pay by any means or the flex time. I think both of those are important, but I also think as an employer, as a board and administrator, and partnering, need to get more creative on how we can make people want to come here and stay here. So I do have some points about the budget. I don't know if you want me to kind of go over the broad points, Mark, and Board of Health, or if you want to focus more on just discussing the pay and raise part right now. I do have some feedback from what you asked me to get last week. I also put together the document that you asked for, and I did pass it out to everybody, that just has some numbers in there like you had proposed about some changes to the base pay grade scale, which has a proposed 2%, 1.5%, and then flat amounts, which you can see there, like a 5 or 3,000, to make it across the board the same dollar amount. That is this one. It says table 1 and table 2 on it. That's just some ideas finance asked me to kind of put together so you could visualize different number amounts. And then if you flip that over, you'll see table 3A. That's for staff that are currently employed here and what the pay ranges are for those who are currently employed and what would happen. The last page, it looks like this. It says table 3B. It was too long. So I got creative, and that just basically goes like that. If you want to get like a nice comparison all the way across and shows what Mark had talked about, which would be implementing different raise percentage levels. The 4% for levels 1 through 7, 2.5% level 8 through 10, and 1.5% for levels 11 through 13, and where those staff would be with those changes. So I know that's a lot to kind of swallow, and not all of this was in your packet because packet was done before I could get it done since we just met last week. But that is there for you to look at. Did somebody say something? Oh. The other thing that I gave you was so many pieces of paper. The one that says job type, other counties, Macon, base pay, Macon County current. I should have put a better header on this, so I apologize that I didn't, but we gave this to the Board of Health last fall, so fall 2021, when we were looking at pay levels to see how competitive or comparable we were to other health departments. We tried to, and other health departments have also tried, to hire a company, a professional company to do a salary assessment. And unfortunately, that wasn't able to be done by any of the administrators in the state or the Administrators Association. So we had an intern and part of our team and some other administrators who worked together to gather that information. So you can see that if that's helpful to you in any way, you can see some ranges from other health departments. There is a note at the bottom that says this is only data that was submitted by health departments that chose to participate. This is not necessarily apples to apples. As you know, there are health departments of all kinds of sizes in counties that are different population levels. Health departments are never directly compared to one another because we all do essential services, but then we add different things depending on what grants we get or what type of organization we're running, et cetera. As an example, our case coordination unit, the Starting Point Aging and Disability Center, we have that here. Not every health department has that. So it's not apples to apples with health departments, but this was what we could gather last year. And so we did share it with our board. And I just thought, why not throw it in so that you all just had it to see kind of where our pay levels were at compared to those other health departments that responded. And as far as percentages, I definitely understand where you're coming from as far as, those higher level of staff are going to get more money if we do it percentage based. Historically, the health department for years has done percentages. Now, years and years ago when the health department was in trouble, which thankfully we are not now, there were years we did not get a raise at all. But other than that, in my recent knowledge, we've done percentages and we've said max percent is, and then the number. So for example, max percentage you can earn is 4%. I have some really strong reservations if we did alter. I'm not against changing it. I definitely am open to changing it. I want to get creative. I want our staff to feel financially stable and appreciated. But to give a lower percentage for staff that are categorized in a higher level, just because they already make more, I have concerns about, not just from an employee morale standpoint. And I wish Mike was here because I kind of wanted his input about, there's been efforts at the state level. There have been rules that have changed in human resources where you have to remove asking about previous salary because of the discrimination that can occur from that. And so I am concerned and would really like legal to give input on if we do give somebody less of a percentage simply because they already make more, that makes me concerned. Those people are in higher levels. They do have a lot more responsibility. They do have to cover pretty much every position in their entire department. And like Mark said earlier, ultimately in their division, everything stops with them. They are accountable for everything. And our level 8s are not supervisors. 9s and 10s are. So you've got level 8 staff who, again, are required to have some kind of credentials or some degree or level of education, or they have to be a nurse. And I definitely, the 9 and 10, I could maybe, talk about if the board felt very strongly, but we really need for those level 8 staff to also be compensated fairly. And our supervisors, the building can't run, those divisions aren't going to run without having very competent, dedicated supervisors. And I would really hate to tell them you're getting less because you've earned being in a higher level here. So those are my concerns. One of the things I did throw on that kind of draft document was if we did a flat amount, and I don't even know if that's a great idea because I haven't had, a ton of time to do a lot of research since our meeting last Tuesday, and I wanted to have this stuff that was requested from me by the finance committee. But I almost feel like if we're going to change what we're doing, do we do a flat number or something to still keep it as fair as possible across the board for all staff to, be bumped up and supported, but not to be, made to feel like they're being punished because they're a higher level or because they make more money. They're making more money here, for a reason. And that's not to say they're more valuable than anybody in levels 1 through 7, because it takes everybody of every level to run this place. I just don't want, I think, the negative impact that could come from breaking it up that way. Those are kind of my thoughts. And then, Mark, I do have more broad budget info if you want that, but I don't know if now's the time to do that or wait if we're more focused on money for raise stuff right now.
I think we need to at least fund.
Okay.
The health fund at 6.9 million right now, and that just quickly, the proposed budget I have in the packet is very preliminary. I have 4% raises in there right now, but if you change that, it's going to greatly affect these numbers. So I didn't go far into all the other reports that I usually do. But with the 4% raises in there, we are sitting at a bottom line of negative 232,000. Since the finance committee meeting, we've already had a few potential changes come through that would get us to negative 138,000. So that would be coming from the health fund at the end of the year. So if these numbers, in fact, were 100% accurate and we really did end up negative 138,000, that would come from the 6.9 million, which is a very large number and can definitely withstand losing 138,000. However, I will also say, this is just a budget and these numbers vary throughout the year. It has been hard to estimate the revenue for our fees throughout the health department because of the impact of COVID and our services the last few years. People weren't coming out to get their regular services like they always had in the past. So estimating the fees for the nursing division is very difficult. So I could be very off in my estimate there, and our revenue could be higher in that division. I don't know if you have other points for the health fund, but 6.9 million is a lot more than we really need to have sitting there. So we are not in a position where we don't have money for 4% raises.
Have we heard anything about countywide what the cost of benefit package increase may be?
The health insurance has stayed the same, and the rate for IMRF actually decreased. IMRF, it's our retirement fund.
Got you.
So benefits will actually be less.
So you did not see any increase for the county, and that's amazing. Is that a 1-year contract?
I do not know the particulars of that. The auditor's office really handles that. We pay, for health insurance, we pay $9,804 for each full-time employee for every year. So I think that just kind of encompasses in the potential for rate increases and all of that.
Well, I think the budget process is probably one of the most important things that we do as a board, and I think it should not be taken lightly. It's very, very consuming in a process, but I think we need to look at it real closely. As far as the pay increases go, I think the health department and the people are very important and very valuable, and we should do everything we can to increase their pay. I am not in favor of a 4% increase. That is probably the max that that the county will give out, and I would not like to see us be at the maximum level. We had that last year. I think the prior 2 years, we had some pretty substantial increases, and be a little bit more conservative with our numbers. I recommended a similar thing to what Mark described, and that we compensate a certain portion at a percentage, and look real closely at the percentage in reward where need be, and give an average amount where need be. And conversely, and I'm sure there's a few situations where maybe not gonna get an increase, but then on the top end, to actually look at some flat amounts without percentage of increase to level things out a little bit, to balance. And I know that's a hard task. That's a hard task for Randy. It's real easy to give out a 4% and to move forward in that fashion, but I think we need to look closely at what we do and be as conservative as we can. COVID money and some of the resources that we've had probably dry up in the next 3 years, and I have to tighten our belts at that point.
Bring up a good point, because I know in my experience at Chick and working at St. John's, there were pay ranges. And when you had met the top of the pay range, then you no longer got a percentage, you got a flat bonus. And that was set in place to not continually raise that pay range higher and higher and higher, so that there was a huge discrepancy among the classes. So do we have pay ranges? I know we have starting pay, but do you have top?
We do not, no. We have, and I've been happy that we haven't, because we do have people who've been here 20-something and 30 years who might be, in one of the, let's say levels 1 through 7, who end up, because they've been here 20, 30 years, making more than like the base pay for, let's say, a level 8 or 9 or something, just because they put in so many years. And so that's where I've been happy, as administrator, that it doesn't cap for them, because otherwise, we're not, in my opinion, I do want to show them, yes, we want you here for a long time. We want you to stay here. We don't want you to leave, so that we haven't been forced basically to cap them in situations like that. I don't know about most. I'm sure that there are some that do. I know I talked to a health department this morning that did talk about, I think what you're saying, once you get to a certain point, then you get like a flat rather than a percentage. So, I haven't seen their formula or anything, but I was just trying to gather as much data as I could to have this conversation tonight. But I know there's at least one health department that does something like that for, when you do get higher up there.
I know you brought it up before about, being competitive or anything else, but this chart here is great, but I would like to see the city look at comparatives, trying to entice people to come here to work and that type of thing. I would like to see where we're at with these jobs. And again, it gets back to where everybody falls onto this chart at. What's a comparable county that's our size, that has similar amount of employees or whatever, and you got this is just counties across the state that have responded. So this, to me, is very, very skewed information, because you don't know if you're looking at Cook County in here or DeWitt County. So your population and the number of employees and the number of jobs, like you said, you got starting point, you got some things that you have here that may not be in another county. I think to really give us some really good data to look at, we need to make sure where we're at, because we need to be competitive, but at the same time, we don't want to be at the opposite end of the spectrum, either too low or too high. I think that's something that's probably pretty easy to come up with some numbers for the different positions. And like I said, that's wanted to come up in conversation. Somebody brought up asking about where's everybody at right now. So if you look at their job, look at their job description, here's the service, current pay, that starts to get into what Carolyn's saying and what you're saying. People's length of service being here, and you got somebody here tonight that's been here a lot of years, you know, and where did they start out at? Where are they at now? Because you got to have a continuation of growth, but at the same time, we got to be responsible with our money. And just because we have a large sum of money in the health fund, it's just no excuse to just start saying, let's just keep pulling that money out, because at some point, we may need it for something. We may have, you know, another pandemic. We may have, you know, some kind of mass casualty type thing that drains a lot of resources. The, you know, IT comes in one morning and says, everything's post. We need this much money to go and buy all new hardware. We're going to have to do all this, and a lot of extra hours, whatever it might end up being. But we need to treat that as our rainy day fund and make sure we've obviously got a good cushion there, but I don't want to be running a deficit budget and just say, well, we'll just go borrow money from over here because we've got it.
Well, I did mention in the finance meeting, so I should also share here that obviously I do not want to see the bottom line a negative number. And I look at that very closely every year. And every year that I've been here, our final numbers at the end of the year have not ended up being negative. So obviously, if I see a continuation of a negative number, I am going to look into why that's happening, and we're going to figure out what we need to change to make that happen. So I just want to make it clear that I'm not okay with seeing a negative year to year. Also, it's always been the recommendation that we should have 3 to 4 months of a health fund balance, 3 to 4 months worth to cover our expenses, our monthly expenses. So 4 months of the average expenses in this budget would be $2.4 million.
Jeff, what'd you say the typical county raise was last year and this year?
The cap was 4%. I don't know that I got a broad range.
The document that was just sent out did not specify a cap. There have been years in the past where it did, and this year it didn't say anything.
Nothing.
No.
I know I went to the meeting last year and there were some different departments that came in asking for things. I remember judicial, the clerk, a couple of them came in wanting more, and they were like, we're going to give you 2.5%. This is what a lot of them got told. And they were looking at, you know, 4%, as Jeff said, or whatever. And they were told, you guys aren't going to get that. We're going to do this. And that's pretty much what we're going to do. We have the ability to come up with what we come up with. Every department manages their stuff differently. It's got different costs and things like that. I just don't want to go back to the table and say, look, we just did blanket thing across the board because it was easy. And again, 4% of making, you know, $26,000 a year, and you get that versus, again, and it's not about punishing anybody that's making more money or anything else. It's about trying to be equitable, because when you look at your percentages here, you took this chart number 2, and you start looking at increases in dollars, low to high end, you're given a bump in pay, while on the percentage side, it looks like there's a big difference there. But in terms of dollars, everybody's being lifted up together. And I think that's important. And I think that sends a message to the people that are on the lower end of the pay scale that you're valued, you're important just as much as management is. And that's just, again, you know, I lead by example. When things went wrong with my business for a few years, I took a pay cut. I made sure everybody else is still getting taken care of. It sometimes you got to make some tough decisions, and you got to do what you got to do to make people feel like they're viable. Because this group of people here, and that's why I'd like to see what the actual employment count is in those different areas. those are the people that are gonna leave. Because, I mean, we're looking at like level, let's just pick one, for example, level 6, level 7, they're making $17 to $18 an hour. They can work at Walmart right now and go put tacos together and make that kind of money. I mean, I saw something the other day, and it's for what used to be a minimum wage job, and they're now paying $22 an hour. I had an employee that's been with me for 3 or 4 years. He comes in and says, "Hey, I hate to tell you, but I'm leaving." I'm like, "Really?" I said, "Why?" He said, "Because I got another job offer to go work at a large corporation here in town. They gave him a $6 an hour increase. I can't afford to do that. I'd love to give the guy a $6 an hour raise, but if I do that, I got 30 other people standing in line saying, 'Where's my money?'" So I think we have to be sensitive to what we do, but these people in these lower categories, they're here, you know, people that have degrees and they're professionals, there's probably a smaller percentage of opportunities out there for the job market for them to go pursue. There's still a lot of people looking for jobs because they want to grow and mature in their level of education or just growing within a company. But when we get down to these lower levels, you're talking people that are making, you know, we're looking at 4 slots here that are making $14, $16 an hour. I can't imagine why they'd even stay here when they can walk down the street and get another job making more money than that. So they are getting some benefits though, because they're getting a lot of paid holidays. I don't know how many we got exactly. They're getting flex time,
No weekends.
you know, no weekends,
rotation
35 hours a
shifts.
week.
They do have to work weekends sometimes and
Yeah,
holidays.
when they got
And nights,
events.
yeah.
But I mean, so there are some
Not as
other
often.
benefits beyond just the cash and what they're getting for the job that they may not get other places.
Correct.
That has an inherent value that's not being factored into this. Maybe that's why some of them are here. Maybe that's why some of them stayed and they haven't gone anyplace else, because they're not gonna go to the box store, make the same amount of money and say, "Hey, I don't have to work nights, I don't have to work weekends. I gotta go in Christmas Eve, you know, Christmas, you know, holidays, people don't get to spend time with their families or whatever." So I think there's a lot of benefits that people garner out of employment here that they may not get at other places, and maybe that's part of the reason they stay. That's why I asked Brandy about what's important, you know, time with family or more money, because I think everybody's seeking something different, and some people like to have a little bit of both. But I'd like to see where we're at in comparison to some other counties, and we've got just a small breakdown here on this, what some of these other counties, you know, are doing. Low and high is a big range when we're not comparing population-wise equivalent. I can't imagine what, you know, Sangamon County or Cook County, I'm sure, are probably at opposite ends of the scale, and we're somewhere, you know, maybe in between, or a smaller county that's got, you know, 2 counties and they got 1 health department. So I don't know, but I'd like to see us continue the conversation to get more information. I'd like to hear where everybody else is at on thinking about differentials and pay at different levels, but I'd like to know where we're at in the marketplace. Because if we're truly low in certain areas, then I think we need to have that conversation and say, we do need, and not only that, that gives Brandy justification to come and say, "Look, I got these people this slot. 4% is not gonna work, 2.5% is not gonna work, or I can live with this here." And part of that is given maybe more to a different segment. I don't know, but I'd like to see us get some more data, and we've got the time.
Do we have final approval, or does the county board have final approval?
We have to vote on it and approve our budget, and then we send it to the county board for final approval. But she's got to do a presentation in September.
We don't have a lot of time.
Yeah.
You're gonna make a lot of changes. We have to have this approved in our August meeting. I have to have time to make the changes.
Yeah, the whole budget is contingent upon whatever's decided with pay, obviously, and fringe, so
So
we
it's
would
got
have
to be
to.
done, it's got to be done next meeting.
Yeah,
Okay.
so we
Yeah.
really kind of need to have an answer tonight, honestly.
Why did we not have till the next meeting?
Why what?
Why did we not have until the next meeting, the 30 days?
Oh, we do. I'm sorry, I might have misunderstood what you asked. I was just saying, have to approve at the next meeting in order to have it ready. Yeah, for September 12th. Sorry, I misunderstood what you're asking.
Well, obviously, we need to have another finance committee meeting between board meetings, so we can maybe hammer out some of this stuff. Take more time for the rest of the board and make some recommendations to the board.
On these where it says low and high, I know what they mean, but can't you call the other counties and ask, not low and high, exactly, hey, what does your blah, blah, blah make, or what's the high, what's the low, I mean.
Well-
It's public record, I'm sure.
It's
but-
public record. You can
Yeah,
look
I'm
it
just
up.
saying, I mean, instead of
Comparable
just
counties.
guessing what they are, can you just say, here is Sangamon County, here's Christian County, here's what this person makes, here's what this person makes,
Yeah, so when we did this last year, there is data that's already gathered that would have been current, I think it was like September of 2021. For me to be able to take on the task of calling all these health departments and then that task, their staff to do a bunch of work to get all of that to me. We have 89 open positions and they're categorized as you can see. So I can definitely gather everything that I have and do as many, phone calls and everything as possible, but I don't know that we'll have like a full-on salary assessment done within, let's say, a week or something. I don't know. I'm being completely honest, I can make a lot of things happen, but to have that be all updated, I don't know if that's realistic in our time frame. But I can definitely get you everything from that last September. It's just in a lot more detail. There's a ton of pages of a spreadsheet, but I could definitely compile that. And, to your point, Mark, if you wanted to do like a finance committee meeting, I can definitely bring that and make it as concise and simple to review as possible, but we can go over that in a lot more detail together. I was just trying to bring you what I could tonight without making it even more complicated than it already was, but I can definitely get you all of that so that you can review it to help make that decision to see where we're at.
Well, I think we're talking about two different things here. I think we're talking about, do we need to have a review of all the wages and see where we are in the marketplace for entry and cap?
Yeah.
And then we have the separate issue of what to do right now this year for a merit raise. But I think they're two separate things.
Well, what Cody's asking for is a lot for Brandy to try to do, and that's why I said, let's get some numbers from comparative counties, and that's done pretty easily. Public information, it's not that hard to look it up, but you need to have these job types and go through and say, this is what these are. But if you get into your sections of what you've got for, these people from a supervisory standpoint, you're calling it level 8 or level 9 and level 10. You got them broken down on here. You got a pretty wide range there. I mean, 30,000 to almost $70,000. That's on supervisor 2, 30 to 190,000. So that's really skewed information. I think we need to have get a half a dozen counties or so that would be comparable size population and staffing, because obviously everybody's running, like I said, different programs, but if the staffing's comparable, I think that would give us a good snapshot for the finance committee meeting to have that along with the printout of employees, years of service pay, because again, how long they've been here, and the job description and what category that those, because if you tell me that so-and-so does, this particular task, I have no idea where they're at on this level here. So I think we had that information break down for the finance committee meeting, probably streamline this quite a bit. And then we can come back, and anybody from the board wants to come to that, of course, is welcome to come. But if we did that, then I think we could kind of make a decision and make a recommendation for the rest of the board to have. And Reese could take that information and get things kind of tightened up with the budget, for next month's meeting. Because it's at the mayor going back and plugging some adjustments. I mean, they've already done this with the information we gave from the meeting last week. She's already put that information there, what it's going to be. And you might come back, Sharice, and say, collectively, this is what the total dollar amount is. If we went with these percentages, how does that impact the overall payroll over the course of the year? That's where the changes need to be. And one more thing to throw into this conversation that's budget related. we talked about this issue with security, so like the rest of the board, Brandy found out we've got to do things differently on the higher back of how we're treating things with the county employees coming back and working at security and stuff, so he had a conversation with the sheriff, and I ended up having one the other day. We both ended up talking to him after we had our meeting. And I guess, correct me if I'm wrong, but basically what the sheriff said was he needs to have a job description, hours required for service, and that type of thing. And then they can come back. There's a couple of options we could do, a contractual agreement. There's some things that have to be done with that. But then we also can look at, what we can and can't do. He said we can't use retired law enforcement. I know it's one of the things we talked about that I thought was really a good possibility. Because retired law enforcement has no way to communicate directly with law enforcement on the street. They cannot legally carry a gun, even though they could as a concealed carry holder, but for sake of law enforcement, they can't. And they also have no arresting powers. So basically, he said what you're doing is you're paying for a really expensive security guard. So the other option is
It's not a good value.
Yeah, you go hire a private security company. So that's one thing I wanted to make sure we covered tonight. That if you could put together what your requirements are, what your expectations are, we can give that to him, because he says depending on how you do it, it'll make a difference on how they can put that together. He said otherwise you end up with somebody that's in their golden years and wants to take this job. He said, now you're paying for one of the highest people to fulfill that. So we have some options on how we can move forward with that. But I know that's one of the problems. The budget that was brought up, that we're going to pay a lot more money up for security now we didn't have to before. And if we get the right recipe for that, that may be another way to reduce that bottom line deficit. So I want to bring that up before I forgot about it.
One really quick thing too, I know that Carolyn did email me this morning about the extra information about staff and the positions and all of that. So we'll be working on getting that to all of you, but kind of in the interim, just for your info, if you're reviewing all of this, I know Mark, you mentioned not knowing where people fall in the different levels. The sample job titles on the pay grade scales, that will show you where people fall. I'm still going to give you the more detailed info, and a lot of what that was that Carolyn requested for the board, we already give to the county, so we were already working on that, so that works well. But just for right now, for your purposes, before we get that additional info to you, you can kind of see in here without people's specific names, what job titles fall in there. And I believe that either has every single job title or we're real close to it. So that can at least kind of give you an idea. And then when you do look at our vacancies list, the one with the highlights on it, more than double of those are level 8 positions. That is the one that we do have the most trouble recruiting, retaining, and paying a comparable salary to. Just so you know that. And then to Mark's point about security, of that number that Sheree quoted, the 232, that would have to come from health fund in this currently drafted budget. That would be lower already. We found out we're possibly getting an additional $15,000 for our local health protection grant. We may be getting a Delta Dental continuation grant, which I think is $63,000 or $68,000. 86. How much? 86. Oh, 86. I flipped my numbers even better. And then 106,000 something of that number is that security to have in front is what we've been paying those deputies on a higher back at time and a half. And I do appreciate Mark and Jeff that you've already started helping with that, because we did try to get a Macon County deputy assigned to the health department back in 2019, and the cost was going to be very significant. And it was going to be over $100,000 for that person, and they would not promise us any coverage. So they said if it was like a senior level officer that, let's say they had 4 weeks, 5 weeks of vacation, they're obviously going to be out of the building a lot, and they would not commit to sending someone in their place. So then we were paying potentially over $100,000 to not have coverage for a lot of days of the year. If that person was sick, they wouldn't attend coverage. So that was under a previous leader in the sheriff's department. So I'm really hoping, and especially with the board's advocacy on that we can come to some kind of agreement to have somebody here, because I'm sure you all have concerns about our staff's safety, just like I do. And so I appreciate that the board's been supportive of that and will continue to be. But that is a significant chunk of that amount of money that would be coming out of the health fund. And I do feel pretty strongly that if we're going to invest some money from health fund, that would be a very appropriate way to do it, as would, salaries for our staff.
And the sheriff said he's very, very supportive to do whatever he can to help us. He did explain to me, I don't know if he told you this or not, Jeff, but he did explain to me, not all county buildings are equal. So, for example, the courthouse, because they have the jail and court officers and that type of thing, that falls under the sheriff's umbrella, whereas the county building, where all the offices are at, that's a totally different thing. That's not their jurisdiction. So they're in the same boat basically that we are here. It's a county building and they will do what they need to do, but they don't get the benefit of being under the umbrella of the sheriff's department. So they have the same situation there with how they have to staff that over there. And I mean, I know those guys are there from the time it opens until it closes. I've seen them, they're there when there's meetings at night, county board meetings, committee meetings, whatever. There's always somebody in the building for that. So they're dealing with the same issue there. And of course, you got multiple departments in that building. So I don't know how they divvy up the pie, how that gets paid. I don't know if it's done through the building commission or how they do that. So, but I did want to bring that up. So we are working on that. And if you get the description and hours required and service, that type of thing, we can forward that to him and then see what he might be able to come up to accommodate us for that. Maybe we'll get what we need, maybe save some money at the same time.
I do have that on my list.
Okay, anybody else got anything for right now? Do we want to set a date for a finance committee meeting tonight? Sure. You guys are sort of doing that, or do you want to think about that or check your schedules or?
Might need two. Let's
Next month's meeting will be on the 16th. Is that correct? Brandy, does that sound right?
Yes.
Okay, so we would need to meet on, to give staff time to prepare to do everything. I would like to see us, let's see, we got 2.5 weeks. By no later than the 8th.
Vacation.
Is that doable for you guys?
We would like to respectfully request a week before that.
Okay, I totally get that. I'm just trying to give you guys time to do what you gotta do now.
I'm good next
For
week.
2 weeks.
I mean, I honestly would like to do next week if we.
I definitely can. I'm not available next week. I don't know if we can get the information together at that time. We can do August the 1st. Monday, unless Mondays are bad for everybody, which Mondays usually are, but whole week of what, the 1st through the. Let me check on something and I might be able to do something, because I mean, if we meet a week from today, I don't think that's enough time. Okay, thank you, Doctor. Appreciate you.
Do you want to just email, because I think that there's also some conflicts. We'll see what maybe the three of you have, and then we can figure it out with our schedules, because I do think Sheree and I both need to be there. So I want to make sure the day that we're both here.
Jeff, you got any days that are just?
I don't, I'm pretty free and I can push.
What about that latter part of next week, Candy? Is there anything that's gonna be? I've got an event that I'm involved with that is a 3-day deal. There's no way I can get myself around that.
Wednesday morning's good.
I was gonna say Wednesday's about the only day I'm gonna have next week without putting it on the following week.
I'm sorry. I'm sorry. I'm not trying to be difficult. that, and Candy, I really want you there, but that, like the August 1st, or I guess later next week.
Okay, you guys check your schedule, Randy and Sharice, see what your availability is. We'll have to do the first week of August then, because I don't want to put it off the following week, because that gives you guys less than a week to prepare. So I'd say either the first or the second.
Yeah,
That gives you guys, if we did it by the second, that gives you guys 2 weeks before the board meeting.
do have, whole budget obviously changes when we put in a change to salary, so Sheree will definitely need enough time to do that before, if you want the final product, because.
Well, your numbers
Also-
on everything else in the budget don't change, it's just the payroll part of it, right?
Yeah, but the payroll goes into every page, every section. If you're gonna change everybody up at different amounts, that's a lot of calculating.
Sure. Again, not trying to be difficult, but just to communicate to you kind of on our end, what we will need and in a timely fashion to be able to actually make it
2 weeks
happen
give you enough time?
by August 16th.
Well, the problem is I have a week of vacation planned.
When,
I'd really like to uphold that because she hasn't had time.
I mean,
no, I'm
like
not,
to spend time with my
I'm
kids.
not saying
Go
no.
back to school.
I'm asking what time?
I was gonna be off the 8th through the 15th.
Shorten it to maybe one day.
I mean, I do that all the time for this place,
Maybe
so
half.
yeah.
Maybe half.
I would really prefer that she doesn't because like I said, she has not been able to
I'm
have
just-
time
I'm
off
just
this
teasing.
summer.
I'm just teasing.
So
Okay.
can we do the first, and then you got the whole week, does that give you enough time to get that?
I mean, I can make that work, yes. I have other responsibilities, obviously, but.
Sounds like everybody's got a conflict the week before of some type. Okay, let's shoot for August the 1st then. Do it early, so that way we can go through it. That way you got some numbers to work with.
9 o'clock again.
I'm okay with doing it earlier.
I would be too.
What time works for you, please?
Whatever.
I mean, what time you guys normally here?
We're here early.
See what,
But
8,
if we,
8:30?
yeah, I think we could make 8:30 or 9
Okay, let's
work.
do 8:30 then.
We could, make earlier work, but I think that would be best for
Any
all the
option for
staff
Zoom?
support.
Is there any option to do it?
So, we can't do the full meeting by Zoom from what Mike has said, but if during a meeting, a board member can be allowed to attend, via Zoom if they are absent for certain reasons. And then, if there's, but they can only be present with a vote, like allowed by the rest of their board members to be attending in that capacity. So there has to be, Mike told me there has to be a vote during that meeting to say, yes, we're okay with Candy joining via Zoom, and you would just join like this.
I can adjust my schedule to be done soon, but I'm going to July.
Well, we're gonna have discussion, make recommendations. We're not gonna vote on officially because it's gotta be given to the rest of the board to actually vote on.
Well, and just as a reminder, usually we do have the finance committee vote on the agenda or budget before it goes to the full board. Historically, what we've done is we do that final finance committee vote on the night of the board meeting or earlier in the day is what I mean, because our meeting starts at
Well, we're gonna
9:30,
have
so.
to, and you bring up a good point, we're gonna have to do that because we're gonna have a committee meeting to discuss where we're gonna end up at on the page. She's gonna take that information, plug it all in, and then come back with the budget that the finance committee is gonna have to review it and approve it. So if we gotta do that, I want everybody on the board to have it, obviously a week or so ahead of time, so whenever she's got it done, if she's gonna be gone on vacation, there's no reason can't send it up to the rest of the board and have it to review. And if there's any questions, then they'll have to let us know before we have the finance committee meeting that night. I mean, there's no other way to do it. We can't have the board signing off on something that she hasn't done yet, so there's no way to vote on before that. The finance committee can anyway. See what I'm saying? Does that
Yeah.
make sense?
And as far as for that final finance committee meeting, do we want to hold that earlier the day of the 16th in advance of the board meeting? That's what we've done historically. Doesn't mean we have to do that, but is that what the finance committee would like to do, just to have your final vote? You obviously will have seen it, so I would think would be doing a full.
Well, I just want to make sure the
presentation.
rest of the board has it in advance to look at it.
They would have it in the packet, I would assume that would go out at least that previous Friday.
But I'd like to have it a little bit sooner than that. If she's already gonna have it be gone, she's gonna have it done by the 8th. Then,
Done before you're done? Depending on what.
Make it
Well, she
happen.
would have to, yeah, she would send it out after we meet on the first,
Right,
whenever
right.
she can get that done.
that way everybody's got time to review it in case something does come up or whatever, but I'm okay with that. Jeff, you okay with me?
Yep.
Finance committee meets for recommendation on the budget, we meet just prior to the next month's board meeting.
Sure.
I don't want to do it early in the day because that's gonna bust days up. So we want to do it at 4:30, 4 o'clock, whatever time you think we need to have to go over it. I mean, I can't, if we've already got everything, and she's giving us information, I can't imagine it being a very long meeting.
I'm good for that day at whatever time the finance committee would like to come, but it is considered open meeting, so I'll have to post it and everything. So if you all just want to tell me for sure what time you want to do it, then that's what we'll do.
Okay.
And yeah, I agree, Mark, we usually do it like immediately in advance, so I think that that would be, per our usual. And if you all have been looking at it,
4:30.
if you think that's enough time, that's completely fine.
And you're bringing pizza. Okay, anything else that anybody wants to bring up? Motion to adjourn.
I second it.
Don't need a motion anymore, and that would.
Yeah, if all the business is done, yeah. Thank you all for coming. Remember to leave your closed meeting minutes so we can.
I need Carolyn and Mark to sign the minutes from last month.
Carolyn, did you hear that? Okay, yes. You heard it. We need your signature on that.
That's what they're gonna sign, we can sign it. He drags me to that.
Uh-huh.